Now to some very important health news. There has been a massive recall of the H1N1 vaccine for children. Our Dr. Jennifer Ashton is here with the details. We need to hear this, Jen. Good morning.
Good morning to you, Debbie. Well, the French company Sanofi-Aventis has announced a voluntary recall of some 800,000 H1N1 flu shots for kids after tests showed the doses lost some strength after they were shipped. But health officials stress there's no need for parents to worry.
The parents do not need to take any action at all. First of all, it has absolutely nothing to do with safety.
The recalled vaccines seen here are pre-filled syringes intended for children 6 months to 3 years old. The CDC says the vaccines were distributed last month.
We believe the vast majority of these doses have already been administered based on the high demand we've had for vaccine.
Health officials say children who have received the vaccines are not in any danger and do not need to be immunized again. Dr. Alana Levine's pediatrics practice received doses of the recalled vaccine, but is reassuring parents.
I will again and again reassure my patients that it's a safe vaccine, they don't need to be worried, and they should consider their children immunized.
And the National Institutes of Health told us they believe the recall was not the result of the company's error, but rather an example of what they called good quality control, Debbie.
It's important to say again that this is not a safety issue, it's a quality control issue. But does this bolster some parents who were resistant to give a vaccine in the first place?
Well, look, the people who are wary of vaccines probably will always be wary of them. And obviously, this is not what they would want to hear. I think that, again, you really need to look at this, that the glass is half full here. Our surveillance and tracking system is so good at monitoring these doses that it was able to pick up this potency issue ahead of time. So that's good.
If a child has gotten the recalled vaccine, do they need to be revaccinated?
They don't. The efficacy dropped about 12% in these 4 lots. So again, because those children needed 2 doses anyway, the thinking is they do not need to be revaccinated. And again, they're looking at these vaccines so closely, they're really on top of the situation.
And there's a booster for this age group anyway, right?
That's right. They needed to have 2 doses, and these were only 4 lots, about 800,000 doses, about 1% of the total number that's been distributed so far. So not a tiny number, but something that they obviously didn't want to see.
All right. So they're on the case here.
They sure are.
On the ball. Dr. Jen Ashton, thank you.